Our next presenter for this morning is going to be Charlie Middleton. Mr. Middleton is a natural resources specialist on the Texas Optimization Program and Response Team in the Emergency Preparedness and Response section of the Water Supply Division. He received his Bachelor's of Science in Marine and Freshwater Biology from Queen Mary College, University of London, and Master's in Aquatic Resource Management from King's College, University of London. He worked as a contractor for the TCEQ Public Drinking Water section from 2010 to 2012, working with bacteriological, chemical, and surface water treatment rule-based violations. In 2012, he became a full-time TCEQ employee working with the surface water treatment rule before joining the Response and Capacity Development Team in 2017, where he works with the Cross Connection Control Program and the Texas Optimization Program. Give him a welcome.
Thanks, Catherine. So, I'm Charlie Middleton. I'm with the Texas Optimization Program in TCEQ. I can be a bit quiet, so can you all hear me okay? I guess generally I'll take questions at the end. If I get quiet, feel free to shout though, and I'll try and speak up again. So yeah, this presentation is going to be on optimization strategies you can pick up fairly quickly, hopefully to go beyond minimum regulatory requirements at your system. It's going to bounce around a little bit. It'll probably be, in some part, snapshots of some other presentations. It's going to cover things that, in small parts that have already been presented on. It'll cover the optimization program itself, optimization in general, sort of a little bit of historical background about successful optimization and changing regulations, and then look at some common things that we find where people can make improvements hopefully fairly easily. The optimization program itself, we're an assistance providing team. We really began with focusing on surface water treatment plants and evaluating surface water treatment plants. And that's extended into technical assistance for distribution system optimization and issues with chloramines and nitrification, DBPs, iron and manganese. And we also provide training for our own staff as well as water system staff on site. And I guess our main focus is really trying to help people make better water without having to make major capital improvements, doing the best you can with what you have without having to spend a massive amount of additional money. So in general, looking at the optimization process, I know the TCEQ, we like giving you lots of forms and documents and monitoring requirements, and it does generally require increased monitoring and increased attention on whatever you're looking at. So as a general rule, when you start looking at things to optimize, you want to pick a parameter, pick something you're interested in and that you care about, that you want to improve, and develop a sampling plan for that, similar to having a monitoring plan. And then you need to start collecting data to determine a baseline and see what your normal conditions are. Current conditions may not be normal, so you may need to collect a long-term data set until you can establish what's normal for you. And that probably sounds familiar to people who've been having to make nitrification action plans if you use chloramines. And similarly, once you know what normal is, you can start establishing trigger levels and action levels and figuring out when you are moving away from what you're expecting to see. And there's going to be an increased data analysis component and troubleshooting when you start seeing differing results. And you need to troubleshoot, investigate the factors you think might be influencing changes in performance, and you investigate those one at a time. So change things one factor at a time to see how they're being impacted. And that'll be rather than a one-off. With optimization, that's going to be an ongoing process. So in terms of why you would want to optimize and go beyond minimum regulations, is really protecting public health as best we can and trying to avoid waterborne disease illness outbreaks as best we can. And in terms of a starting point, I have no plans to just sit here and read rules and regulations to you, but having a firm grasp of what those minimum requirements are and what the rules and regulations are in the area you're looking at is an important starting point to know what you need to achieve. In the broadest sense, with the rules and regulations, the EPA and the state require you to provide safe and adequate water to your customers. and they write rules and regulations to define what constitutes safe and adequate. And safe usually refers to water quality, and adequate normally refers to water quantity. But having a good grounding in the rules is going to help you if you try and go beyond them. So what are we trying to optimize if we're trying to improve our performance with the goal of protecting public health? Well, it's really looking at the multiple barriers that you have in place to prevent pathogens reaching your customers, and making each of those barriers as strong as you can. So in terms of the common barriers that risks and barriers that you're going to encounter, there are some pretty broad categories that we're going to cover. There'll be source water, which could be surface water or groundwater. You can have a water treatment plant, either a surface water plant or less complicated but still groundwater treatment plant. And then you're going to have issues in distribution, including cross-connection, disinfection, water age issues, water pressure issues. So these are all areas where you can look to go beyond minimal regulations. And there's another diagram showing the common risks. So you have a surface water source or a groundwater source leading to a treatment plant, entry point, and then into the distribution system. Surface water is more susceptible to fecal contamination to pathogens, and groundwater is generally more susceptible to geological contaminants and pulling whatever's in the aquifer into the water, although groundwater can also be susceptible to pathogens and viruses. There can be issues with poor treatment plant design on the surface water side, or inadequate treatment, or poor operation. On the groundwater side, on the plant is normally inadequate disinfection, which can cause an issue. And then out in distribution, you can have problems with cross connections and main breaks, and also water age. If you have a lot of storage and little use, you can have issues in your storage tanks. So in terms of successful optimization in the past, these rules are up here just showing kind of the origins of regulations in Texas. So we had the first annual Waterworks short school for operators in 1920. You had Social Security Acts in 1935, which included funding for the state health department, and then Texas has adopted the first rules in 1937 for well construction, location, and connections. And so I covered that because anything prior to that, beyond those regulations, can be seen as optimization. So chlorination began roughly in 1908. So this is a CDC graph showing the impact of chlorination on the death rate in the US from typhoid fever. So in 1900, about 30 people out of every 100,000 died of typhoid. Chlorination began roughly 1908. That death rate dropped to about 8 per 100,000 in 1920, 0 in 1948, and the disease was eradicated in the country by 1950. So this is just an illustration of people going beyond what's required and trying to protect public health, and that being effective. More recent times, the EPA, created in 1970, and they've taken a big role in water regulation and optimization. They established the requirements for states, including capacity development and licensing. And they've also worked quite a lot on the optimization side. The optimization program in Texas started in 1995, and that was really a result of the 1993 surface water treatment rule. They tightened the turbidity requirements from an average of 1 to 95% having to be no more than 0.5 NTU based on 4 hourly samples as opposed to the daily samples every month. And that was due to increased concern about Giardia disease outbreaks. And then shortly after that rule was implemented, there was the Milwaukee cryptosporidium outbreak, and the turbidity requirements were tightened further than that. And due to those events, the EPA created the Composite correction program, which includes comprehensive performance evaluations, which is a pretty large part of what our team does. Essentially, based on individual filter effluent turbidity triggers in a treatment plant, we may be required to go and evaluate a surface water plant and look at the design, operations, maintenance, and administration of the whole plant to really find out what the performance limiting factors are in that plant that are preventing them from meeting the turbidity requirements. So really it's a very intensive, it's about a week-long evaluation. And there's more than we can cover here with everything we do. So, but to start, looking at the map of areas in surface water treatment where you can optimize, it really focuses within the plant. So a few of the common things that we find that could be helpful, which operators should be able to do with pretty much with what they have, include a filter assessment where essentially we look at the worst performing filter and we ask the operators to drain it, empty it of water, and then, so you don't damage it, we just put a couple of plywood boards down and we get into the filter and probe at regular intervals throughout the filter, going down to the gravel under drain. No, you don't push a probe, you don't damage the under drain or push into the gravel. But we're measuring the depth of the media and the distance from the gravel or the under drain to a reference plane. And we usually use the top of the filter trough, or the backwash trough, because they're level as a reference plane. And then when you do that throughout the filter, you get measurements of the levelness of the under drain and the depth of the filter media, and also the levelness of the filter media. And you can see whether it's varying more than it should, whether you have low spots. And then you also make visual observations if they're obvious, mud balls on the filter, or if anything looks out, essentially. And based on that, you'll then take a couple of points to excavate the filter, which is kind of like a hand digging coring, really, where we just pull the filter meter out, in a cylinder, a few inches at a time, and just analyze the media, its condition, its shape, whether it has particles adhering to it. If you have a mixture of anthracite and sand, how defined is that interface? Where does it start? Where does it end? You want that to be pretty narrow. And that can be a useful tool for determining whether you have an issue with a filter that's preventing you from reaching your turbidity requirements. When that's complete, we put the filter media back in the order that it came out, and then usually we have a system conductor backwash, which will also assess. And you can use a gauge, a simple gauge, to measure the bed expansion. You can look at your changes in ramp up and ramp down and how you're changing your flow during your backwash to see if you're negatively impacting your filter in any way. And really the only tools you need for those are a probe, a gauge, which are both pretty simple, and some plywood boards. So that's probably one of the main tools that often operators have seen being used but tend not to do. They take a little bit of time. We usually do them in the morning, but they can be a useful process. There are other fairly frequent issues we encounter in surface water treatment plants. That includes, does your plant match your CT study? Are you getting the credit that you should be getting for pathogen inactivation? Are your chemical injection points where they should be? Are they in the sequence that they should be in? Are your chemical feed pumps all working and are the capacities correct? Do you check their feed rates and that they are accurate? And then there are also operational issues. Obviously, operators get used to running tests very frequently. You might have several operators. I know we like giving people paperwork, and we're big on standard operating procedures, but are all your operators following the same method when they're running tests? And is it the right method? If you've been doing something for years, have you cut steps out? Are you following the procedure, as required by the manufacturer? There are also, corrective or scheduled maintenance programs can be helpful in reducing costs in terms of fixing things before they break and become more expensive. So that's some simple parts of a surface water evaluation that should be pretty straightforward to check and start looking at. The comprehensive performance evaluation is mandatory, although we are an assistance providing team, we have to do those. We also conduct special performance evaluations, which are pretty similar, but there's more of a data collection exercise, and it's more looking for systematic errors that might just be occurring every day in a plant. So if there are surface water plant operators who'd be interested in those, we can arrange those if you think that there are improvements you could possibly make into your plant and you would like our help. So although the optimization program began with surface water, we do also provide assistance for groundwater and distribution issues. Although surface water is a bigger risk for having pathogen issues, groundwater it can be vulnerable to viruses, and there are roughly 20 times more groundwater plants than surface water plants. And then everyone has to use a human-engineered distribution system to get their water to their customers. So we do look at helping people with both those areas. So I'll look at a few of the areas where we frequently find people can make improvements in terms of optimizing. And the first is you're using your monitoring plan. It's a central point which is organizing all your information in one place so you can see what you're analyzing and where. And it's also something that probably needs to be maintained and kept up to date. In various parts of this state, there's a lot of development and a lot of growth at the moment, and the monitoring plan will include your sample siting plan and your distribution map. So you need to make sure you have representative sample sites for your whole system. And if your system's growing and you have new development, you may need to change your medium and your high water age sites, and then you may need to introduce more Back-T sites. We tend to give people advice on dead-end main flushing quite a lot. It can be impactful in several ways. And also when small systems where operators are busy and they're working in the plant and distribution and meter reading and everyone's busy, I think we find that the flushing program is frequently the first thing that gets dropped. In terms of the rules, we do have rules to design distribution systems to eliminate dead ends and allow circulation if possible, and to flush dead end mains monthly. And the purpose of the monthly flushing is to ensure fresh water reaches stagnant areas. You avoid issues with disinfectant, DBPs, and nitrification. So you need to sample at least monthly and include dead ends and your distribution tanks, communicate your issues with management, and keep adequate records. You can integrate your disinfection sampling, and the last point of finding beneficial uses for flush water may be a pipe dream, but I'll put it in there anyway. So with flushing, this is really, and I'll include tank cycling of storage tanks here. It's mainly a water age issue, especially if you have long lines and low numbers of connections. You'll have degradation of your disinfectant if you're using chloramines, and you have ammonia. You'll be more likely to have nitrification if you have high water age sitting in lines for a long time. So you can go some way to eliminating those by flushing, and we also recommend that you practice unidirectional flushing as opposed to just exercising valves and flushing throughout every month, in terms of having a kind of sequential one direction flushing where you're focusing on particular pipes, and you can pick that water velocity up above 5 feet per second. You can start scouring a line and removing biofilm while you do that. And then similarly with storage tanks, if you have a lot of storage, it's not being used, and depending on the design of your storage tank, especially if it's filling and emptying from one line coming in and out the bottom, you may have stratification and end up with a portion of water that's staying in your tank for a long time. So if you periodically reduce the volume in that tank as much as you safely can while still maintaining adequate pressure and being able to provide people with enough water, and make sure you're cycling that water over as best you can, and remove some of the issues you may have with high water age in the flushing program. And you'll also find that it's probably a good idea to exercise your valves, and sometimes people shut valves off and you haven't realized and they forget to turn them on, or I think we've been to systems and tried to find valves and they found that a road crew had paved over them, so it's probably it's a good idea to do that fairly regularly, to keep on top of your system. The next area will be disinfection, and this is probably going to focus on, where we'll focus on chloramines and what you're required to monitor really for controlling that process. So hopefully everyone knows the minimum requirements of 0.2 milligrams per liter free chlorine and 0.5 milligrams per liter total chlorine through the entire distribution system. And that's for pathogen inactivation and stopping biofilm growth in your pipes. As far as the maximum, the MRDL of 4 milligrams per liter, that's really linked to taste and odor complaints. There haven't been observed effects, negative effects on people in studies for chlorine levels well above what you're likely to find in a distribution system. So the distribution system is, again, part of your monitoring plan, your map and your sample siting plan. So you make sure that your sample sites are representative of your distribution system and that you're monitoring on the correct frequency, which is weekly if you've got less than 250 connections or 750 population, or daily if you have more than that. And you'll report on your DLQOR. If you're a community system, if you're non-community, you can keep those on site. If you're a surface water system, then you turn in your disinfectant data as part of the surface water monthly operating report. This is the breakpoint curve for anyone not familiar. And for systems that are chloraminating, this is really just going to be a reiteration of what you need to sample to be able to accurately control that. So when you add chlorine to water with ammonia, to begin with, there'll be reactions with things like soluble iron and manganese or hydrogen sulfide or reducing agents. And when you first add chlorine to water, you won't see an increase in chlorine until that demand's been met. Then when in the presence of ammonia, you will start seeing a total chlorine increase, which is the first curve where you can see the blue monochloramine going up with it. And that's really where you want to be, near the top of that curve, where the ammonia is being converted just to monochloramine. You just have one chlorine replacing one hydrogen, and virtually all the total chlorine is monochloramine, which is the effective disinfectant that you want to have. And that stays that way until a ratio of roughly 5:1 chlorine to ammonia as nitrogen. When you get beyond that and you continue to feed chlorine, you start attaching additional chlorines to those monochloramines. You start forming dichloramines and trichloramines, which are not stable or as effective as monochloramine, and it causes taste and odor complaints. And that's really that second side of that curve where the total chlorine level starts to drop and the monochloramine is dropping off as well. And the reason the total chlorine is dropping off is that additional chlorine is also starting to convert into things like chloride, which are not part of the total chlorine test. So you're starting to make products that aren't included as total chlorine, so the overall level drops, and the total chlorine that is there is not what you want to make. And you reach the bottom of the curve, a total chlorine, which is a breakpoint where there is no additional space for chlorine, all the ammonia is used. And at this point, adding free chlorine is going to increase the total chlorine, and the chlorine that's present will be free chlorine. So the issue there, if we take these away, is that if, for example, you have a residual of 1.5 milligrams per liter there, that exists at 3 points on that curve, and the only place that you want to be is on that first slope. And we really want your monochloramine to be at least 85% of your total chlorine, but we want it to be as close to all of it as you can be. And we just spent some time at a system that was just monitoring total chlorine, and they'd lost all their monochloramine. They got flagged because they had a nitrite MCL at their entry point, and they ended up on a do not use order. So there is a purpose to monitoring the full suite of constituents. So you can't just, if you want to be able to control your chloramination process, you can't just sample for monochloramine. You have to monitor the total chlorine, monochloramine, free available ammonia and free chlorine. And one of the other points is that obviously free chlorine and free available ammonia react very readily together, so you're not going to get those two existing independently of each other. So one way to know that you're sending water out on the top of that first curve where you want to be is if you have a trace of ammonia going out into your system. Not a huge amount, but if there's some ammonia there, you know you're not going to be on the two far sides of that curve and that you're still going to be on the first side. Your chloramine will naturally decay and break down and release ammonia back into the system. So you will see, under normal conditions, a gradual loss in your residual and a gradual increase in ammonia as you move out through your distribution system. So in terms of an indicator for nitrification, if you're sampling all those constituents and you notice that your free available ammonia is disappearing, and you haven't tied it up by introducing additional chlorine, you don't have any injection, if you have ammonia re-emerging as your residual decays and then the ammonia disappears, that means something is likely to be consuming it. And you probably have an issue, especially if you're losing your residual at the same time. And then the last area we're going to focus on is the backflow prevention and cross-connection control. So cross-connection is a physical connection between treated water and less treated water. And that can occur in distribution or it can occur at various points in treatment plants. And backflow is the reversal in direction of flow in a potable water system, and that can either occur by back pressure or by back siphonage. So in the case of back pressure, you would have water being pumped at a higher pressure than your distribution pressure, someone with their own private well and auxiliary system and a pump that hooks up to your supply, and they're running a higher pressure will push their water back into your system. Or back siphonage, where you lose pressure, the water moving back in your pipe will pull whatever was submerged hose pipe is in an animal trough or a swimming pool, and will pull that water back into your system. And there's quite a broad range of things you can do for having a cross-connection control program. Generally, as a minimum, regional staff, when they're investigating, will come out and they will want to see your customer service inspections and your test and maintenance forms for assemblies that are required to be tested. Some people don't have particularly good tracking in place for figuring out when assemblies are required to be tested and when they're not. And there's also quite a lot of communication required between different areas. So cross-connection control is going to impact, there's going to be fire line testing, so there's going to be a fire marshal office involved. There's going to be your municipalities permitting and code enforcement, and if you know whether new builds are being conducted, if you have plumbing inspectors, you need to kind of be communicating with people to know where new hazards are, where you need to be having CSIs done. The customer service inspection is really done under three circumstances: where there are new builds, where there's reason for you to believe there's a hazard, or where there have been plumbing alterations. So staying on top of that, knowing what the hazards are in your system is important. There are also sometimes cyclical or periodic CSIs might be necessary. There are certain hazards which require an RPZ or an air gap, and if you allow an air gap for a private well, for example, it's very easy then for someone to make a cross connection after that. So if you allow air gaps, you may want to conduct periodic checks to make sure that they are being maintained. You also should make sure you've given yourself the authority to shut people off if you need to. So you should either have a customer service agreement or an ordinance giving you that authority. And we also have guidance for other preparations for actually dealing with an incident or having a response plan in place, making sure your distribution operators are trained and are capable of isolating issues when they occur quickly and containing any problems you have. And also having a management plan in place in terms of sampling and flushing and notifying the public and notifying the TCQ if you do happen to have an issue. Overall, there tends to be an operations focus with optimization, things like corrective, preventative maintenance, looking after your equipment. There's generally an increased analysis and monitoring requirement, and it requires more focus and paying attention more deeply to things than the minimum rules require. Establishing more triggers and actions for changing conditions when you know what your normal conditions are, and then responding to those. And there'll be an increased requirement, to troubleshoot issues and to document your procedures. And these areas that we've covered are areas we can provide assistance in. All the areas discussed today, either our optimization program or our financial, managerial, and technical assistance people can help you with those issues if you're having them. So really, optimization is looking at regulations as a starting point and adopting best practices, focusing on public health beyond the regulations. And I guess we'll end with a communication, coordination, and cooperation requirement. We have worked with systems where people haven't really got on, not within the water system. We've been to places where plant staff and distribution staff weren't really communicating and didn't really want to be in the same room as each other, which made solving their problems pretty difficult. They were having DVP issues, so you had the treatment plant trying to keep their residual as low as they feasibly could to remove their DVPs, and then you had a distribution system with very long lines and a low population who were having to flush a lot to maintain a residual. So you ended up with a distribution staff who felt that the plant staff were lowering the residual to make them flush, and a plant staff that felt the distribution system were flushing to make them make more water and work more hours. And their issues were complicated, but it wasn't helped by their inability to communicate or really tolerate each other to begin with. So obviously not everyone's going to like each other, but those two components, your treatment plant and your distribution system, they really have to communicate and can't just be two separate entities. You have to share information with each other. There's no need to keep secrets with from your own staff and your own team, essentially. We've also had issues recently between purchase water system and their supplier, which probably could have been caught sooner if there was more monitoring of more than total chlorine, because by the time people realized there were issues, they were pretty widespread. But if there's more communication between a wholesale and the purchasing system, it can be very beneficial, especially during a chlorine conversion where you really have to coordinate. So there is a benefit to fostering good working relationships within your system, and with other water systems, your neighboring systems, especially if you're purchasing from them. So these are my contact details. Sorry if I was too quiet. Hopefully you could hear me. So thanks for your time. Does anyone have any questions? No, it's free. It's free for TOP to come out, and it's also free for financial, managerial, and technical assistance to come out. So if anyone's interested in any, we have 8-hour, one-day training courses available for everything we've discussed and more. And on the math side, one of the things I was going to mention during the discussion of the surface water treatment plant is also I know there have already been math presentations and workshops at this event, but sometimes you'll have an equation written on the wall of a surface water treatment plant that was written 6 operators ago that's being followed blindly. Maybe understood or maybe not, but it is important to understand the math, which can be kind of complicated. So we also have training for the math side of things.
The training you just mentioned comes with continuing ed hours for the operators. That might be a good hook to want to get them involved.
Yeah, so I think we have approval for credits for some of our training materials.
A slight comment on earlier is like when you're optimizing or doing things at your plant, only change one factor at a time. Because a lot of people don't understand statistics, and they start trying to change 2 or 3 things at a time, and you can't figure out what your results really are. You have to stick with the one item at a time.
Right, yeah. I mean, yeah, it's not going to be possible to pin down what's had the impact if you're changing more than one. Okay, thank you.